Hi, my name's Cindy Davis, and this is the story of my journey to learn more about advocacy through Doctors for America's Copello Fellowship. I've raised four kids, and I enjoy being kept on my toes by my wonderful husband of very different politics. I practiced OB-GYN in South Dakota for 24 years. My practice currently is in the town of Chamberlain in the middle of South Dakota, and I have a great patient mix caring for Native Americans, farmers, and ranchers in several Hutterite colonies. For some time now, though, I have felt frustrated with how my state has handled women's care and related issues. The goals of DFA resonated with me profoundly, and I'm so grateful for this opportunity. I worked on several projects throughout the year, including a letter to the editor regarding Medicaid expansion in South Dakota and contributing to an amicus brief filed before the Supreme Court. I learned to advocate with the federal legislature in Washington, and locally, I've enjoyed connecting to local tribes and local legislators. I'm working on a toolkit for providers in South Dakota involved in women's care, focusing on rural medicine. Using skills I learned through the fellowship, my first venture was a letter to the editor. South Dakota was one of the few states who resisted Medicaid expansion for what I believe were essentially political reasons, but a ballot initiative brought this directly to the voters. I learned to be persistent and follow up on my submissions. Moving forward with letters, I'll start the process earlier, as a few papers required several avenues to get attention, such as phone calls and emails. I was published in the Rapid City Journal, which serves the western half of our state, but ran up against obstacles with the major newspaper on the eastern half. Likely, this reflected their staffing issues, as a few months later they hired an editor and started publishing letters to the editor again. Through this, I learned that sometimes no means later. And the most important skill is always to tell the story of your patients. I'm happy to report that Medicaid expansion was passed. I also provided written testimony in an amicus brief involving the legal and safe use of mifaprostone for women's care in the case before the Supreme Court, Danco Laboratories versus Alliance for Hippocratic Medicine. Although I do not provide abortion services, I support the legality of reproductive choice for women, and I learned that I could contribute by telling the stories of the harm to women resulting from the inability or difficulty in obtaining necessary care and medication in the current politically charged atmosphere. I learned to own my credentials. I may not be a professor, but I am an OB-GYN with many years of experience. I learned to be careful of the stories I tell. South Dakota is a state of fewer than 1 million people, and I practice in a small community. But I could tell enough of my stories to make my experience relevant to the topic. And I hope to be part of a future testimony regarding some of the infringements on women's care that are ongoing in South Dakota. Through the Congressional Leadership Conference in Washington, D.C., through ACOG, I used many skills I learned from the fellowship. I learned how to focus on the ask and how to use stories with a group to paint a picture. We did lots of homework and lots of practice and made our South Dakota group concise and smooth. We learned to persist despite disappointments regarding the lack of attention from our South Dakota representative and senators, the lack of any preparedness from 2 of the 3 aides we met, and threats from a legislator on the Hill to the CLC regarding participants regarding any discussion of abortion. We learned to persist. I would never have had the confidence to participate in this in the past. The skills I've learned have helped me advocate for my rural and indigenous patients' care within my health system organization. I've pushed for a more just system of drugs screening, advocated for the funding of educational opportunities within the tribes, and pushed for equity of care, including adequate facilities for laboring moms. I'm pushing for a labor room size consistent with the traditions of Native American families and the aunties present at childbirth. I'm happy to report my organization has been receptive and supportive. I'm currently working on advocating within our state. I learned it's important that the decision makers understand the unique needs of rural medical care. For example, applying for a state grant for education for Native Americans, it was necessary to point out that solutions for bigger towns would not work in our part of the world. We do not have Uber. I'm incredibly excited to use what I learned in the Copello Fellowship. I hope to advocate at our legislature and support the South Dakota Right to Abortion Amendment coming in 2024 in any way I can. I'm developing a toolkit for rural women's providers to facilitate access to important state resources, education regarding reproductive care access, and issues specific to rural medical care. Thank you so much to DFA and our amazing Copello fellow educators for everything.